So guys, today we'll discuss about the indication of thiazide diuretics. These are the name of some thiazide or thiazide-like diuretics commonly used in our country, like hydrochlorothiazide, indipamide, chlorothalidone, and metolazone. Of these, hydrochlorothiazide is the prototype of thiazide diuretics, and indipamide, chlorothalidone, and metolazone are some thiazide-like diuretics, right? So what is the most common or popular indication of thiazide diuretics? The most important indication of thiazide diuretics or thiazide-like diuretics is essential hypertension or hypertension. So how thiazide diuretics works as an antihypertensive drug? To understand this, we have to examine various segments of nephron, right? So this is a nephron and this is glomerulus. This is proximal convoluted tubule. This is loop of Henle, and this is distal convoluted tubule. And distal convoluted tubule has lot of cells. These are cells of distal convoluted tubule. So, what is the function of cells present in the distal convoluted tubule? We can see this is a cell of distal convoluted tubule. This is the lumen, and this is the interstitial space, and suppose this is the blood vessel. So there is a sodium and chloride co-transport, and through this co-transport, first sodium and chloride enter into the cell, and then sodium leave the cell through the sodium potassium ATPase, and then sodium enters into the blood circulation, and chloride leave the cell through a chloride channel, and then chloride enter into the blood circulation. This is how in distal convoluted tubule sodium chloride co-transport protein leads to reabsorption of sodium and chloride. What thiazide diuretics do? Thiazide diuretics or thiazide-like diuretics blocks this channel, right? When thiazide or thiazide-like diuretics blocks the sodium chloride co-transport, sodium and chloride cannot be reabsorbed, right? So thiazide diuretics inhibits reabsorption of sodium and chloride from distal convoluted tubule. So they block sodium chloride co-transport protein in distal convoluted tubule. So they block the reabsorption of sodium and chloride in DCT or distal convoluted tubule. When sodium chloride reabsorption is inhibited, then there's loss of salt and water, right? If you cannot reabsorb sodium chloride from the kidney, that means you are losing salt and water from the kidney. When you lose salt and water from the kidney, blood volume is reduced, right? When blood volume is reduced, there is decreased venous return, and when venous return is decreased due to decrease in blood volume, when venous return is decreased, it is logical that there will also be decreased in cardiac output. When there is decrease in cardiac output, this leads to reduction in blood pressure. This is how thiazide diuretics reduce your blood pressure. Second thing is that thiazide diuretics also decrease your total peripheral resistance. That means it dilates the smooth muscle, or it helps in dilatation of smooth muscle or blood vessel. When it helps in dilatation of smooth muscle in blood vessel, that means it decreases total peripheral resistance. And when total peripheral resistance is decreased, there is decrease in blood pressure. Thiazide-like diuretics like indipamide has some additional property, like it can block calcium channel in vascular smooth muscle. When it blocks calcium channel in vascular smooth muscle relaxes. And when vascular smooth muscle relaxes, there is decrease in total peripheral resistance, and decrease in total peripheral resistance lead to decrease in blood pressure, right? So this is the antihypertensive mechanism of thiazide diuretics. Second important indication of thiazide diuretics is idiopathic hypercalciuria. Normally, we can go to whiteboard There are many situations when there is increased calcium secretion in the urine, right? This is the glomerulus, this is kidney tubule, and there's increased calcium come into the urine. This is called hypercalciuria. When there is increased calcium is present in the urine, it is logical that this calcium must come through the blood. So there will also be increased calcium concentration in the blood. So when there is increased calcium concentration in the blood, this excess calcium will pass into the urine, and this will lead to hypercalciuria. So hypercalciuria usually occurs due to hypercalcemia or increased calcium in the blood. But there is a situation called idiopathic hypercalciuria. In this situation, if you measure the calcium level in the blood, surprisingly the blood calcium level is normal blood calcium level. But if you measure idiopathic hypercalciuria, but if you measure the calcium level in the urine, there is high calcium in the urine. That means for unknown reason this patient has increased excretion of calcium in the urine. For unknown reason this patient has increased excretion of calcium in the urine because they don't have uh, high calcium in the blood. So this situation is called idiopathic hypercalciuria or hypercalciuria due to unknown reason. So what is the problem actually? If excess calcium pass into your blood, or excess calcium, sorry, if excess calcium pass into urine, what is the problem? If excess calcium is passing into the urine, this excess calcium in the urine leads to formation of calcium stone, and this is a very dangerous condition. Increased calcium in the urine can lead to formation of calcium stone in the kidney. That means anywhere in the kidney, in the pelvis, in the bladder, or in the ureter, anywhere a stone can form. So what we can do? We can advise this patient to drink increased amount of water, and second, we can also treat this patient by giving hydrochlorothiazide. So what is the role of hydrochlorothiazide in this particular condition? Hydrochlorothiazide actually increases calcium reabsorption from the kidney, right? When hydrochlorothiazide increases calcium reabsorption from the kidney, there is reduced excretion of calcium in the urine. And when there is reduced or decreased excretion of calcium in the urine, this leads to this decreases the risk of formation of calcium stone, right? So what does hydrochlorothiazide do? Is suppose this is a kidney glomerulus, and this is kidney tubule, and this is tubular cell, and hydrochlorothiazide increases calcium reabsorption. When hydrochlorothiazide increases calcium reabsorption into blood, that means you have decreased calcium in the urine. That means if you have decreased calcium in the urine, or you have decreased calcium in the tubular fluid, right? Tubular fluid. So when you have decreased calcium in the tubular fluid or in the urine, that means there is decreased chance of calcium stone formation. There is decreased chance of calcium stone formation. So hydrochlorothiazide increases calcium reabsorption from the kidney and reduces calcium excretion. This leads to decreased formation of calcium stone in the urine. Now, how hydrochlorothiazide reduce calcium uh, excretion, or hydrochlorothiazide increases calcium reabsorption? You can see this is a distal convoluted tubule. This is a cell of distal convoluted tubule. This is the lumen, and this is the luminal membrane, luminal cell membrane, and this is the basolateral cell membrane. This is the basolateral cell membrane. In the basal cell membrane or basolateral cell membrane, there is a transporter called calcium sodium exchanger. You can see there is calcium sodium exchanger. So what does hydrochlorothiazide do? Hydrochlorothiazide blocks this channel. When hydrochlorothiazide blocks this channel, sodium cannot enter into the cell. If sodium cannot enter into the cell, intercellular sodium concentration goes low. When intercellular sodium concentration goes low, or there's decreased concentration of sodium inside the cell, this pump become superactive, because when sodium concentration inside the cell goes low, this this transporter becomes superactive, and this transporter called sodium calcium exchanger transport sodium from interstitium into the cell, because intercellular sodium concentration is now low. So concentration gradient for sodium transport is high. So sodium is transported from interstitium into the cell through this transporter. So when sodium is transported, at the same time, this transporter transport calcium from cell into the interstitial space and ultimately into the blood. So this transporter transport calcium from cell into the interstitial space and ultimately into the blood circulation. When this transporter transport calcium into the blood circulation, right, intercellular calcium concentration goes low. This intercellular calcium concentration decreased, so calcium that are present in the lumen now can easily enter into the cell, because concentration gradient or concentration difference for calcium is increased. So what is the summary? The summary is, when you have blocked the sodium chloride co-transport by thiazide, sodium concentration inside the cell become low. And when sodium concentration low, this pump transports sodium from interstitial space into the cell. And at the same time, this pump transport calcium from cell into the interstitial space. When this pump transport calcium, calcium concentration goes low, and so calcium from lumen is transported through this calcium channel into the cell. That is how thiazide diuretics increase calcium reabsorption, and when they increase calcium reabsorption, they actually decrease the amount of calcium in the tubular fluid. So they decrease the amount of calcium in the tubular fluid, so there is less risk of stone formation or less risk of nephrolithiasis. Stone in the kidney is called nephrolithiasis, so there is less risk of nephrolithiasis. So in idiopathic hypercalciuria, we can use this thiazide diuretics. Then the next condition is called congestive cardiac failure. In this condition, there is a lot of retention of fluid from the kidney, because in congestive cardiac failure, you all know that there is decrease in cardiac output, and decreased cardiac output leads to retention, leads to activation of renin-angiotensin aldosterone system, and this renin-angiotensin aldosterone system leads to retention of fluid, and this retained fluid creates a lot of problems, like if this retained fluid is deposited in the lungs, they create shortness of breath, or they may deposit it in the abdomen, create ascites and hepatomegaly, or deposited in the leg, creates ankle edema. So what thiazide do? Thiazide actually inhibit this fluid retention by the kidney. So thiazide increases fluid excretion by the kidney by blocking sodium chloride co-transport. So thiazide is helpful in congestive cardiac failure, because they inhibits this fluid retention by the kidney, right? Because they are diuretics, so they inhibit fluid retention in congestive cardiac failure. But the most important drug is loop diuretics. So if you have mild type of congestive cardiac failure, it is you can use thiazide diuretics, because it is a very low potency diuretics. It is not that much of high potent. And last two indication, I don't have uh, convenient explanation for this. One is diabetes insipidus and another one is Meniere disease. There are many type of explanation available in the internet, you can see that, but I don't have convenient explanation. Diabetes insipidus, basically a condition where you don't have antidiuretic hormone from the brain or posterior pituitary, so you cannot retain water from the kidney, so you lose a lot of water in the urine, and this leads to very high volume of diluted urine. In this condition, the best drug is antidiuretic hormone because you don't have antidiuretic hormone, but some patient antidiuretic hormone doesn't work well. In that type of patient, thiazide diuretics may be helpful. Again, I have to say I don't have any convenient explanation. And another one is Meniere disease. It is a disease of the inner ear. Patient may present with tinnitus, vertigo, and other things like vomiting, nausea. But I don't know how thyroid diuretics is helpful, may be helpful in this situation. So thank you very much. In next video, I will discuss about the side effect or adverse effects of thyroid diuretics that is very high yield and important. Thank you very much.